I was 25. And then I started recognizing different patterns, different like feelings of anxiety that I didn't feel before. I thought I was just always energized. And so I thought like, oh, my superpower is I have all this energy. And actually I think I'm just anxious.
I'm so grateful that you are doing this with us. You know, we have a big mission. We are trying to end the concept of mental illness by creating a revolution in brain health. And so I want you to help us make brain health cool.
I love it. I'm in. Count me in. I'm on this couch ready to go.
And I want you, when we finish in an hour and a half or so, to love your brain and be really excited about making it better.
I love it. I'm in.
I read your history. I've looked at your scans. I've seen your testing. I have sort of a good idea. But tell me your goal and how I can help you the most.
Well, first, thank you for having me. And I'm really excited because I think knowledge is power. And I think just educating myself in what the brain functions are and also just simple things that you think you are supposed to know that you don't know, at least for me, is what I'm really excited to learn. So I think I'm just like curious and I'm open. And I think my main goal with wanting to do all the testing was just to see where I was at as a 35-year-old person who has gone through so many different stages of life and traumas and healing and motivated by, success and stuff like that versus fulfillment. And I've had so many different iterations and I feel like lives that I'm really happy in this current iteration of who I am. And now I just want to be able to maintain and sustain and like figure out a way to be as sharp as possible, as long as possible. And hopefully, especially with my positioning, make brain health cool and have other people feel like they are empowered by themselves and their knowledge of who they are and what they can do, and pass that forward. So that's what I'm excited about.
Awesome.
Yeah.
All right. So when I read your paper, you said you want to feel focused, present, quick, sharp, and energetic more regularly.
Yes.
And one of the questions you had was whether or not you have ADD. Because when you filled out the questionnaire, a lot of ADD questions came up.
Yeah.
So actually 3 things came up. ADD. So we'll talk about that. Sleep apnea. Have you been tested for sleep apnea?
I've never been tested.
You need to.
Okay.
Because you snore heavy.
Oh, yeah.
And
I have very funny stories about that.
That's probably not good for you. And if you have sleep apnea, it's critical to treat it. Because obviously it's not your weight that's causing it.
Yeah.
All right, here are the checklists. These are the adult ADD questions. Trouble sustaining attention.
Yeah.
Difficulty completing things, feeling overwhelmed, trouble maintaining an order. And this is on a scale of 0, never, 4, very frequently.
Very frequently.
I guess the question I would have is, when did it start?
I was 25. And then I started recognizing different patterns, different like feelings of anxiety that I didn't feel before. I thought I was just always energized. And so I thought like, oh, my superpower is I have all this energy. And actually I think I'm just anxious. and so once I started like trying to understand the sensations in my body, I was like, oh, this is very different than a superpower. This is actually not great. If activated in a good way, in a healthy way, then sure. But I definitely was like in overdrive constantly and like burnt out.
Genetics, there's sort of a lot in your family.
Yeah.
So who else has ADD, you think?
I think my brother.
I think so too.
I actually think he might have been diagnosed with it when he was a kid. But like my mom didn't put him on any, medications or anything like that. She just put us in all the activities possible.
Which is one of the natural treatments for ADD, is intense exercise. And you loved it.
We loved.
Right? And that's one of the things that fools people.
Yeah.
People with ADD, it's not attention deficit for everything.
Yeah.
It's attention deficit for regular, routine, everyday things like schoolwork, homework, paperwork, chores, math, the things that make life work really hard. But something that is new, novel, highly stimulating, interesting, or frightening, people with ADD can pay attention just fine because those things have their own intrinsic dopamine.
Interesting.
And so, especially for girls are way underdiagnosed because they tend not to bring the negative attention to themselves that boys do. And I often diagnose women when they bring me their 6-year-old son. I'm like, so where did this come from?
Yeah.
So.
Yeah. But I'm pretty sure all my sisters and my mom and my dad, I think we all have it. Pretty sure.
Do you think more from your mom's side when you look at her family or more from your dad's side?
Both. Oh my gosh, both. Yeah.
So we do a study called SPECT, and SPECT looks at blood flow and activity. It looks at how your brain works. And we have a database of about 250,000 scans and then compare your brain to everybody else. And here's a healthy scan. And a healthy scan tells us 3 things. Good activity, too little, or too much.
Okay.
And then our job is to balance it. If it doesn't work hard enough, we want to activate it. If it works too hard, we want to calm it down. And so here's a healthy scan. Here we're looking underneath the brain, down from the top, one side, then the other. And healthy, it's full, it's even, it's symmetrical. It's the only part of you really want big and fat. These are your temporal lobes. They're going to come really important for you. And then this view shows us the active scan. So here, the color doesn't matter. It's the shape.
The shape, okay.
Here, the color does matter. Blue is average activity. Red is the top 15%. White is the top 8.
Okay.
So white's like the most active areas of the brain. And it should be here in the cerebellum.
Okay.
And here in an area called the posterior cingulate gyrus.
Okay.
Now, when we look at your scan, little bumpy, and that could be the alcohol. And here in the front, it's low. That's often where we see ADD. And your cerebellum, I'll show you in the next one, it's sleepier, especially in an athlete. And we often see if this and this are sort of low together. It's like, that goes with ADD.
Okay.
And that plus the symptoms you complain about, treating that could be really helpful. And given that it's in your family, and so many parents go, oh, I'd never give my child medicine. But it's sort of like, would you give your child glasses? And if, of course you would, right? The problem is ADD is not one thing. It's like 7 different things, and giving everybody Ritalin. For some people, it's miraculous. And for some people, it's a nightmare. And your emotional brain is busy, but sort of it's hijacking everything. Everything's sort of sleepy.
I like when you say sleepy, because that I feel that. I'm like, I know I'm in there. I just feel like there's just layers of something that just feels like I'm sleepwalking a little bit. And I'm like, I know I'm in there because I know what I feel like. But this ain't it.
Well, and if we both agree you're awesome, but you could be more awesome,
Yeah.
then psychiatry is not a shaming profession. It's a hope.
1,000%.
So that's the goal.
I thought that there was a lot of white, though, in the other, like, healthy one. And you don't want white?
There is a lot of white in the healthy one. If we go back to the healthy one, that's where we're going to get this. We're going to calm your emotional brain, and we're going to activate your cerebellum.
So because I only have the like one dot of white right there, that's what you're saying.
It's sort of hijacking the rest of it.
Okay.
So you need to calm that down. How many days out of 7 do you exercise?
Probably like 5 to 7. Like I'll
For
take
how
it. An hour and a half, maybe.
Yeah, your coordination center should be way busier. Questions?
I don't even know kind of what to ask right now.
So when you look at your scan, how does it make you feel?
I still feel like a little, like, I don't know what to do, but it's nice to see that there's going to be reference to measure. So that's nice.
So I think of it like a map, right? You've heard a picture's worth 1,000 words.
Yeah.
But a map is worth 1,000 pictures. A map tells you where you are, and it gives us direction on how to get to where you want to go. Without a map, you're lost. Okay. So now we need a plan. So what's the plan? So yes, I think you have ADHD with some past emotional trauma. There's lower activity here and here, which sort of makes me think of a concussion or multiple concussions, right? But you have a family history where most people are ADD. So which brings chaos and trauma.
Yeah.
For sure.
It does.
I think you should take 2 packets a day.
Okay.
It's my NFL formula.
Okay.
I did the big NFL study when the NFL was sort of lying it had a problem with traumatic brain injury in football. And I gave them fish oil, a brain boost, and a great multiple vitamin.
Okay.
So in the packets, fish oil, brain boost, great multiple vitamin.
Great.
And then we could either do focus and energy. That's a natural supplement for focus, or I could give you Adderall or Concerta.
What's the natural?
It's called Focus and Energy.
Okay.
It's got rhodiola, ashwagandha, ginseng, choline, and a lot of my patients like it a lot.
Yeah, I would love to start there.
And then why don't we chat and like in a couple of weeks, maybe 2 weeks, and go, how's it going? I think doing the EMDR would be
Do you have a
amazing.
recommendation for, like, I wouldn't even know where to go search for a person or a therapist to do that.
You know, maybe let me do a session with you.
Oh, okay.
And
Oh, you do it.
I do it.
Oh, okay. Okay, yeah.
And then I want to order a sleep study.
Okay.
Because I think we need to take the snoring seriously. And I may have you talk to Dr. Criado. He is my sleep doctor.
Okay.
You will love him. I love
Right.
him. And then I'll give you Put Me to Sleep to try to see if it'll get you through the hump
Okay.
at night. They're chewables, and I'd start with 2, and you can go all the way up to 4 at
Wow.
night.
Okay.
And then I would sort of like you to keep a little log for me on sleep and energy and focus, sleep, energy, and focus. I think that would make sense. And if you just rate them 0 to 10, 0 is awful, 10 is awesome, we'll know if what we do is helpful.
Okay.